Hi everyone, I am Dr. Vardhelli Venkateshwarlu, Senior Consultant Neonatologist at the Birthplace by Cloudnine Hospitals, Banjara Hills, Hyderabad. Like all the newborns, the extreme preterm babies also lose some weight in the first week of life. They reach their birth weight usually by 2 weeks of age. The premature babies require the amount of the milk as per their birth weight and gestation age. The preterm babies are fed initially with tube feeding and then later either with bottle feeding or spoon feeding. The babies who are born before 32 weeks of gestation. In the initial days, the babies are started with very limited amount of milk, with 20 to 30% of the milk initially, and slowly upgraded gradually every day 10 to 20% of the milk. Once they reach 32 to 34 weeks of gestation, will be assessed for their capacity in accepting a spoon or a bottle feeding. If the babies are able to take the spoon or bottle feeding, they will be started slowly on the spoon or bottle feeding and will be fed as per their requirement, which is called ad-lib feeding. Once they reach their intended full feed based on their birth weight, the intravenous fluids or artificial nutrition will be stopped. The premature babies usually take 2 weeks of time to reach their birth weight. After that, the preterm babies gain 20 to 30 grams per day. Most of the premature babies take at least 12 months to 24 months to have a good catch-up growth and to reach the potential of a term baby, which is normal for a preterm baby.